Welcome back, everyone, to another deep dive. This time, we're really going back to the basics with infection control and asepsis. And we've got a real expert here to help us break it all down.
It's great to be here. We're going to cover a lot of ground, but I promise we'll make it engaging and thought-provoking, even for those of you who think you've heard it all before.
So let's get started. What is an infection, really? I mean, we toss the word around a lot, but what's actually happening in the body when we talk about an infection?
Well, an infection starts when these tiny invaders, we call them pathogens, get into the body. These pathogens can be bacteria, viruses, or fungi. And when they get in there and start multiplying, that's when you have an infection. It's like they're waging war inside you.
Okay, so it's a battle going on inside us. But wait a minute, aren't all microbes, like those bacteria and fungi, bad? We hear about good bacteria all the time now, right? Like the stuff in yogurt?
That's a great point. You're right, not all microbes are villains. In fact, you have tons of microorganisms living in and on your body right now, and many of them are actually good guys. They're essential for your health. Think about the bacteria in your gut. They're helping you digest food, they're on your team. The problem is when those harmful pathogens, the bad guys, show up and cause trouble.
So it's not about wiping out all microbes. It's about keeping the harmful ones in check.
Yeah.
Right? And that's where this whole idea of the infection cycle comes in, doesn't it?
Yeah.
I always imagine it as the pathogen's playbook, kind of like their strategy for taking over.
Exactly. It's like a 6-step relay race for those pathogens, and if we can break the chain at any point in that race, we can stop the infection from happening in the first place.
A relay race. I like that analogy. So walk us through those 6 steps. What are the key stages in this infection cycle relay?
Okay, so the first runner, the one kicking things off, is the infectious agent itself. This is the culprit, the bacteria or virus that's causing the problem. And then we have the reservoir, which is like the pathogen's home base. This could be a person, an animal, or even an object where the pathogen is hanging out waiting to make its move.
Okay, so the pathogen has a home base, but how does it escape? How does it spread from that reservoir to someone else?
That's where the portal of exit comes in. It's like the escape route for the pathogen. It could be through a cough or sneeze or even just shedding skin cells. And once it's out, it needs a way to travel, a mode of transmission.
Right, so that could be direct contact, like touching someone who's infected, or maybe indirect contact, like touching a surface that's contaminated. And of course, there's airborne transmission. I always think of those tiny droplets flying through the air.
You got it. And even if a pathogen manages to travel, it still needs a way to get inside a new host. That's the portal of entry. This could be a cut or scrape, or even just inhaling those airborne droplets we talked about. But even then, the battle isn't over yet. The final runner in this relay is the susceptible host.
And this is where the host defenses come in, right?
Yeah.
Like a healthy person with a strong immune system. They're like a fortress.
Exactly. But some people are more vulnerable to infection than others, like the very young, the elderly, or those with weakened immune systems. They're more like fortresses with weaker walls, easier for those pathogens to break through.
Okay, so let's put this all together with a real-life example. Let's say we have a young man, we'll call him Jackson, and his mom is in the hospital with a respiratory virus.
Okay, so Jackson goes to visit his mom, not knowing she's contagious. She coughs, releasing those tiny droplets filled with the virus. Now Jackson, without a mask, inhales some of those droplets. That's the portal of entry. Now, if Jackson's immune system isn't strong enough to fight off the virus, he could become infected, and then he could potentially spread it to others, continuing that cycle.
Wow, that really brings it home how easily those pathogens can spread. It really highlights how crucial it is to understand the infection cycle and break the chain wherever we can.
Yeah.
But let's talk more about those infectious agents themselves. What are the main types we encounter as nurses? I mean, we've got bacteria, viruses, fungi. It's a whole world of microscopic invaders out there.
It is, and each of them has their own, their own quirks, their own characteristics. So you have your bacteria, they come in all sorts of shapes and sizes, and the way they're built, their properties determine what antibiotics we can use to fight them off. Then you've got viruses, they're much smaller than bacteria, and you can't just treat them with antibiotics, right? They need a different approach.
Different foes, different weapons, right? What about fungi? We hear less about them, but they can cause trouble too, right?
They absolutely can. They can cause a whole range of infections, and understanding what makes them tick is really important for choosing the right treatment.
Okay, so we've got bacteria, viruses, fungi, a whole army of microscopic invaders trying to get us. But luckily, our bodies have this incredible defense system to fight back.
Oh, absolutely. We have this amazing multi-layered defense system designed to keep those invaders at bay. It's pretty remarkable when you think about it.
So let's break down those defenses. What's our first line of protection?
Think of it like a castle with walls and moats. Our first line of defense is like that outer wall. These are the physical barriers that try to keep pathogens out in the first place. We're talking about our skin and our mucous membranes.
So the skin acts like this tough shield, and those mucous membranes, like in our nose and mouth, they're like sticky traps catching the invaders.
Precisely. But those pathogens, they can be pretty crafty. Sometimes they manage to get past that outer wall. So that's when our second line of defense kicks in, the inflammatory and immune responses.
Okay, this is where it gets a bit more complex. Can you walk us through it?
So the inflammatory response is like the castle's alarm system going off. When there's an injury or an infection, the body sends out these chemical signals. They cause redness, swelling, and pain, all the things that make us uncomfortable when we're sick or hurt. But it's a sign that our body is fighting back.
So it's sending reinforcements to the battleground.
Exactly. The increased blood flow brings white blood cells to the area. They're like the brave soldiers rushing in to attack the invaders. And then we have the immune response, which is a more targeted approach. It involves two main branches: humoral immunity and cell-mediated immunity.
Okay, hold on. Those are some big words. Can you explain those two branches in a simpler way?
Of course. Think of humoral immunity like launching guided missiles. It involves these special proteins called antibodies, and they're designed to target and destroy specific pathogens. And then you have cell-mediated immunity, which is more like hand-to-hand combat. Specialized cells go in and directly attack and destroy infected cells.
Wow, so we've got these incredible defenses working for us all the time. But we mentioned earlier that some people are more susceptible to infections than others. What are some of the things that can weaken those defenses?
Well, age is a big factor. As we get older, our immune system naturally weakens a bit, making us more vulnerable. Chronic illnesses can also play a role, along with certain medications, and even stress can suppress our immune system.
So it's not just about external factors, but also our internal state and overall health.
Exactly. And that's why all those healthy habits we hear about are so important. Eating a balanced diet, exercising regularly, getting enough sleep, it all contributes to a stronger, more resilient immune system.
It sounds like it's a combination of our natural defenses and our lifestyle choices that determine how effectively we can fight off those microscopic invaders. But now let's switch gears a little bit and dive into the arsenal of techniques that nurses use to prevent the spread of infection.
Absolutely. We're stepping into the world of asepsis, the foundation of infection control in healthcare.
Okay, so let's unpack that concept of asepsis a little bit. What are the key techniques that nurses use to keep themselves and their patients safe?
We have two main categories. We have medical asepsis, also known as clean technique, and then we have surgical asepsis, or sterile technique. Medical asepsis focuses on reducing the number and spread of pathogens. So we're talking about everyday practices like hand hygiene, wearing gloves.
So minimizing the risk of infection in routine care settings.
Exactly. Surgical asepsis takes it a step further. We're trying to eliminate all microorganisms. And that includes those tough spores for procedures where we need a completely sterile environment.
Think like inserting a catheter or changing a sterile dressing. Situations where even the tiniest microbe could cause serious complications.
Absolutely. And hand hygiene is paramount in both medical and surgical asepsis. It's the single most effective way to prevent infection transmission.
I feel like we've all heard that a million times, but it's so easy to forget just how powerful hand washing really is.
It's true. Washing your hands with soap and water or using an alcohol-based hand rub can really dramatically reduce the spread of pathogens.
So simple, yet incredibly effective. But how can nurses make sure they're doing hand hygiene correctly and consistently? It's easy to get caught up in a busy shift and let those things slip.
That's where the WHO's My 5 Moments for Hand Hygiene can be really helpful. It reminds us to perform hand hygiene at key moments before touching a patient, before a clean or aseptic procedure, after body fluid exposure risk, after touching a patient, and after touching a patient's surroundings.
Those 5 moments really do seem to cover all the bases. But hand hygiene is only part of the equation. We also have all those other forms of protection, like personal protective equipment, right?
Absolutely. PPE is like suiting up for battle against those microscopic invaders. We're talking about gloves, gowns, masks, and protective eyewear.
It's about creating a barrier between ourselves and those potentially infectious materials. But using PPE correctly is just as important as choosing the right type, isn't it?
Absolutely. Nurses need to know how to put it on, take it off, and dispose of it properly to prevent contamination. For example, with gloves, it's crucial to choose the right type for the task. Make sure you inspect them for any tears or holes and change them frequently. Love barrier failure can happen, so we can't become complacent.
And when it comes to masks, we've got different types for different situations, too. We have surgical masks for routine care, but then we need those N95 respirators when we're dealing with airborne infections like tuberculosis.
Exactly. Those N95 respirators filter out those tiny airborne particles that can transmit some pretty serious infections. It's all about selecting the right level of protection based on the specific situation.
This really highlights how much thought and care goes into choosing and using PPE effectively. But what about those situations where we need even more precautions beyond those standard practices?
That's where contact, droplet, and airborne precautions come into play. These are additional measures that we implement when caring for patients with specific types of infections that require an even higher level of vigilance.
Okay, so walk us through those different types of precautions. When would we use each one?
Sure, contact precautions are used for infections that can be spread through direct or indirect contact.
So we're talking about those superbugs like MRSA.
Exactly. With contact precautions, nurses wear gloves and gowns when they enter the patient's room, and we're really careful about how we dispose of contaminated materials.
So it's all about containing those pathogens and preventing them from spreading further. What about droplet precautions?
Droplet precautions are for infections that spread through larger respiratory droplets, things like the flu or meningitis. In addition to standard precautions, nurses would wear a surgical mask when caring for these patients.
Makes sense. And lastly, airborne precautions. These are for the most serious, most easily transmissible infections, right?
Right. Airborne precautions are for infections that can spread through those tiny airborne particles we talked about earlier, things like tuberculosis or measles.
So we're talking about those negative pressure rooms and N95 respirators to really prevent those particles from escaping and infecting others. That's a whole other level of protection.
It is, and it's crucial to understand when each of these precaution levels is necessary so that we can break that chain of infection and protect both our patients and ourselves.
Okay, so we've covered a lot of ground just now, understanding the chain of infection, the body's defense mechanisms, hand hygiene, PPE, and these additional precautions. It's a lot to take in, but it's also essential for providing safe and effective care.
It really is. It's about layering these protective measures and being vigilant in every interaction we have with patients to prevent those pathogens from spreading.
This has been incredibly insightful. But there's still so much more to explore in this world of infection control. So stay tuned as we delve deeper into some real-life scenarios, talk about the ethical considerations, and discuss some of the emerging challenges that every nurse needs to be prepared for.
Okay.
Okay, so we left off talking about all those different precautions, and I know something that's always on my mind and probably a lot of our listeners is those superbugs, those multi-drug resistant organisms, or MDROs as we call them. Why are those so tricky to deal with?
Oh, those MDROs, they're a real challenge in healthcare. They've developed this resistance to multiple antibiotics, and that makes them really hard to treat. So infections they cause, they can be much more severe, they can last longer, and sometimes our usual treatments just don't work as well.
So it's like they've leveled up, right? They've got these extra defenses that make our usual weapons ineffective. So if antibiotics aren't always the answer, what can we do to combat these superbugs?
It really comes down to prevention. We need to be extra diligent about those infection control protocols we've been talking about, hand hygiene, using contact precautions for patients who are infected or colonized, and really being on top of cleaning and disinfecting the environment. Those are our best weapons against these superbugs.
It sounds like a really rigorous approach, but absolutely necessary when you're dealing with these tough adversaries.
Exactly. And sometimes hospitals will even use a technique called decolonization to try to reduce the number of MDROs that patients are carrying. And this involves using special antiseptic washes or medications to try to eliminate those MDROs from a patient's skin or nose. It's not always effective, but it can be a helpful tool.
So it's about being proactive and using every tool we have to prevent those resistant organisms from spreading. Can you give us some examples of some of the major MDROs we might encounter in a healthcare setting?
Oh, absolutely. So some of the big players include methicillin-resistant Staphylococcus aureus, or MRSA as we call it. And then you have vancomycin-resistant enterococci, or VRE. These can cause a whole range of infections, from skin and wound infections to more serious bloodstream infections.
Those are definitely the ones we hear about most often. Are there any other MDROs that we should be aware of?
Another group that's particularly concerning is the carbapenem-resistant enterobacteriaceae, or CRE for short. And these bacteria are resistant to some of our strongest antibiotics, so infections they cause can be life-threatening, particularly for patients who are immunocompromised.
Wow, that sounds incredibly serious. Is there anything unique about preventing the spread of CRE?
The same rigorous infection control protocols apply: hand hygiene, contact precautions, environmental cleaning. Those are paramount early detection. And isolation of patients with CRE are also really important to prevent widespread outbreaks.
It's extra cautious, extra aware when we're dealing with CRE. Got it. Now, there's another MDR I want to talk about, one that's often associated with antibiotic use, Clostridioides difficile, or C. diff as we know it. Can you tell us more about that one?
Oh, C. diff. C. diff is a tricky one. It's a bacterium that can cause severe diarrhea, especially after someone's taken a course of antibiotics. And what makes it so challenging is its ability to form spores.
Spores, right? Those are those tough little things. Remind me what those are again.
So spores are like these tough, protective shells that bacteria can form to survive in really harsh conditions. They can linger on surfaces for a long time, resisting even our usual disinfectants.
So even if we think we've cleaned a surface thoroughly, those C. diff spores could still be there waiting to cause an infection.
That's right. And that's why it's so important to use the right cleaning agents and techniques when we're dealing with C. diff alcohol-based hand rubs alone. They're not enough soap and water are crucial to really remove those stubborn spores.
This really highlights how different pathogens sometimes need a totally different approach. What is it about C. diff that makes it show up after someone's been on antibiotics?
Well, antibiotics can disrupt the balance of bacteria in the gut, and that can create this environment where C. diff can really thrive. It's kind of like the antibiotics wipe out the good guys, and then C. diff sees its opportunity.
It's like they're playing a game of whack-a-mole in there. It really emphasizes how important it is to understand the interplay between all those different microorganisms and to really think about the potential consequences of antibiotic use. So speaking of eliminating microorganisms, let's talk about sterilization and disinfection. What's the difference between those two?
Sterilization is the big guns. It destroys all microorganisms, including those resilient spores we talked about. Disinfection, on the other hand, eliminates most microorganisms, but those tough spores might still survive.
So sterilization is like the ultimate reset button, ensuring absolute cleanliness.
We use sterilization for anything that's going to enter a sterile body cavity or tissue, things like surgical instruments, implants. Disinfection is more for surfaces and equipment that are going to come into contact with intact skin, where that risk of spore contamination is lower.
Makes sense. The level of clean depends on the job it's got to do. Can you walk us through some of the methods we use for sterilization and disinfection?
Of course. So one common way to sterilize things is using steam under pressure in a machine called an autoclave. It's like a high-powered pressure cooker for microbes, using that combo of heat and pressure to eliminate everything.
That sounds pretty intense. What about when you can't use an autoclave?
Yeah, for items that can't handle that high heat, we might use other methods like ethylene oxide gas or dry heat. And for disinfection, we have a whole range of chemical disinfectants, things like bleach and alcohol solutions. Those are commonly used for surfaces and equipment. And then you have ultraviolet radiation, UV light, which can be used to disinfect surfaces and even the air in some settings.
So many different tools for the job, and nurses need to be really well-versed in all the proper procedures for each method to make sure we're using them safely and effectively. Speaking of safety, let's talk about preventing occupational exposures to bloodborne pathogens.
Yeah, protecting healthcare workers is just as important as protecting our patients. We face unique risks in our line of work, and it's so important to minimize those risks through proper practices and protocols.
And this is where OSHA, the Occupational Safety and Health Administration, comes in, right? They set the standards to keep us safe.
Exactly. OSHA has standards that are specifically designed to protect healthcare workers from exposure to bloodborne pathogens, things like HIV, hepatitis B, hepatitis C. And these standards cover a lot of ground, from using safer medical devices to providing those sharps disposal containers.
So it's a really comprehensive approach. What are some of the key safety measures outlined in those OSHA standards?
Well, one important measure is the use of safer medical devices, things like needles that have safety features to help prevent accidental needle sticks. We also need to have those sharps disposal containers readily available so it's easy and safe to get rid of used needles and other sharps.
Those little things can make a big difference in reducing the risk of exposure. But accidents can still happen, even when we're being super careful. What happens if a healthcare worker does have a needle stick injury or some other potential exposure to a bloodborne pathogen?
Immediate action is key. The wound need to be washed thoroughly with soap and water. The incident has to be reported to a supervisor, and then you follow the facility's post-exposure protocol.
What does that protocol usually involve?
It often includes something called post-exposure prophylaxis, or PP.
PP, what is that?
So PP involves taking a course of antiviral medications after a potential exposure, and this can significantly reduce the risk of actually developing an infection. It offers peace of mind and potentially life-saving protection.
That's good to know. It's reassuring to know there are steps we can take to protect ourselves, even after a potential exposure. So we've talked a lot about protecting ourselves, but let's talk about another group of patients who need extra protection when it comes to infection control. Immunocompromised patients, what makes them so vulnerable?
So immunocompromised patients, they have weakened immune systems for various reasons, and that makes them very susceptible to infections. And often these infections actually come from the patient's own body rather than an outside source.
That makes sense. So what extra precautions do we need to take when we're caring for these vulnerable patients?
Standard precautions are always the foundation, but we might implement additional measures depending on the patient's situation. So that might include things like wearing a mask and gown when entering the room, limiting visitors, and even avoiding bringing things like fresh flowers or plants into the room, because even those can harbor microorganisms.
So it's about creating a super clean environment to protect these patients from any potential source of infection, even things that might seem harmless to a healthy person.
Exactly. And it's really important for healthcare workers to be extra vigilant about their own health as well, making sure they're not coming to work sick and potentially exposing these vulnerable patients to something they can't fight off.
That's such a good point. It emphasizes the importance of self-awareness and responsibility as nurses, not just for our own well-being, but for the well-being of our patients. It's all connected.
It really is. We're all in this together. And by understanding the principles of infection control, we can create a safer environment for everyone.
We've really gotten into the nitty-gritty of infection control, all the science behind it, and the practical steps we take. But, at the end of the day, we can't forget that this is all about people, right? Real people's lives are impacted by these tiny little bugs we're talking about. It's easy to get lost in the technical stuff, but infection control is really about caring for each other.
You're so right. It's about human connection. We have to understand the science and use those evidence-based practices, absolutely. But we can't forget that we're dealing with people who have feelings and fears in unique situations we have to approach infection control with that human element in mind.
I think that's a really important point, and sometimes those human connections can create some tricky situations for nurses, right? Like, let's say you're caring for a patient and a family member wants to visit, but they're clearly sick.
Yeah.
How do you balance compassion with protecting your patient?
Oh, that's a tough one. It happens all the time in those situations. Communication is key. You have to gently explain the risks to the family member, educate them about infection control, and see if there are other ways they can connect with the patient, maybe a video call or sending messages. It's about finding creative solutions while still keeping everyone safe.
It sounds like building those strong relationships with patients and families can really help in those tough conversations.
Absolutely. And sometimes advocating for infection control means advocating for your patient, even when it feels a little uncomfortable. Like, what if you notice a colleague isn't following proper hand hygiene? What would you do?
That's a tough one. Speaking up to a colleague, especially someone who's been a nurse longer than you, can be intimidating. But we know patient safety is the priority. So how can a nurse address that concern effectively?
I think it's about finding that balance between being assertive and being respectful. Maybe start with a gentle reminder, just frame it as, hey, we're all in this together, let's protect our patients.
Right.
But if the behavior continues, you might need to go to a supervisor, make sure that patient's well-being is protected.
It takes courage to speak up, but it shows how committed nurses are to advocating for their patients. And, when we think about the big picture, advocating for infection control goes beyond just individual patients. It's about protecting entire communities.
That's so true. We saw that so clearly with the COVID-19 pandemic. Infectious diseases, they don't stop at the hospital door, and they can spread so quickly if we don't take those preventative measures seriously.
It was a wake-up call for a lot of people, a reminder that we're all connected, and that even small actions like wearing a mask or washing our hands can have a huge impact on the health of our communities.
And nurses are in a unique position to be leaders in infection control in their communities, educating the public and promoting those healthy habits that can make a difference.
It all circles back to shared responsibility. We all have a role to play in breaking the chain of infection and preventing those tiny but mighty pathogens from spreading.
Well said. It takes knowledge, vigilance, and a commitment to those evidence-based practices to protect ourselves, our patients, and our communities.
Well, that wraps up our deep dive into the world of asepsis and infection control. We've covered a lot of ground, from the science behind it to the everyday practices that make a difference.
Remember, knowledge is power. And by understanding these principles, you're better equipped to provide safe and effective care to your patients.
Keep learning, stay curious, and as always, keep those hands squeaky clean.